Good morning. I'm Dr. Fry, and this is Capital. Today we're going to talk to you about administering insulin. Insulin is a very important drug in the use of for control of diabetes. Diabetes is seen in our patients often as they get older, and the use of insulin is really critical in controlling the diabetes disease. Insulin is always given with food or with a treat. And as a result of that, our dogs and cats tend to look forward to the insulin injections. It's not nearly as difficult as what we try to make it. Insulin needs to always be kept refrigerated. Insulin is a protein which is very susceptible to heat, and even heat at room temperature. Insulin always settles to the bottom of the product's bottle. So prior to use, insulin needs to be gently rolled and shaken to resuspend the most important portion of the insulin drug. So gently turning it over and rolling it in between your hands suspends the product into a uniform solution. Insulin must always be given with the appropriate needle. Every insulin product is labeled with a U number. U100, U40, U30, things along that line. The product label will always be on your box, and it should always match the insulin syringe. The label will also have its U number as well. So the U40 for the syringe and the U40 for the insulin need to match. So today, for demonstration purposes, we are not going to inject Capital with insulin since he is not presently diabetic. But we will show how to do the injections appropriately so that the dogs feel comfortable, and at the same time you'll understand how to use the syringes. So when we are using our insulin syringes and needles, it does make the dogs and cats much more comfortable if we are using a new needle each time. Each needle comes prepared with a cap to protect the needle itself and a plunger to protect the actual dispensing product. When we are using our insulin, pretend this is the insulin, you will turn the insulin over so that the bottom portion, which has the plug in it, faces the floor. When you're injecting or putting the needle into that cap, you'll want to put the needle directly into the center of the plug, which is where the plug is the thinnest and causes the least amount of damage to the needle. When pulling the insulin into the syringe, pull slowly and gently and steadily so as to not get very many air bubbles into the product. Each dog will have a set number of units that they should administer to the individual. That will be based on your findings with your veterinarian. So when monitoring or measuring your insulin, you'll want to pull the plunger down beyond the amount that you are going to give. So for instance, in this case, if we want to give 2 units, we're going to pull it down to 5 units. And once we've pulled that down, we'll check for additional bubbles at the top of the syringe, and then while the needle is still in the insulin, push it back up to the amount that we want to give. So our 2 units will then have the bottom of the line level with the top of the plunger, and that will be our amount to administer. Once that has been drawn into the needle, then remove the insulin bottle and replace it back into the refrigerator. And while you're doing that, you can put the cap back on the needle so that you don't accidentally cause trauma to the needle. When it's time to administer the drug, we like to have food or treats ready to give to the patients, especially something that they look forward to, because we want them to anticipate something pleasant associated with the injection. Our injections can be given in 4 places: behind the shoulders on either side, or in front of the flank on either side. This is where the animals have the most dependent skin, and therefore it has a little bit more mobility and a little less pain associated with it. When we give the injection, we want to pinch the skin so it forms a tent between our thumb and fingers, and then put the needle right in between the thumb and finger into the tented triangular area. At that point, you can drop the skin, administer the injection, and once the injection has been administered, then we want to make sure that we give the individual their treat so that they don't feel the discomfort of the injection. That's a good boy, Cappy, good boy. There you go. I should have warmed that up a little bit. Capital thought that was a little bit cold. And that's one of the advantages of rolling the syringe in between, or the insulin in between your hands a little bit, is it warms it up at room temperature and makes it a little bit more comfortable for the patients. Insulin is designed to decrease circulating blood glucose. Sometimes blood glucose becomes too low. So it is important for you with your diabetic patients to always have some form of easy access sugar to counteract the impact of insulin should it become too great. When the blood glucose drops too low, our patients sometimes get a little drunk-like. They stagger, they may act a little dumb or stuporous, and at that point you want to reach for something that they quickly and easily can absorb. My favorite is honey, and I like to put a little honey right inside the lips or gums of their teeth, and especially back in the cheek pouch where the honey or sugar in the form of jelly can be absorbed rather quickly. You can use Karo syrup, you can use honey, you can use jelly. All of those things will counteract a low blood sugar rapidly. If it doesn't respond within a period of time that's acceptable, usually about 5 to 10 minutes, you can repeat that sugar dose, whether it be in the form of honey or jelly or Karo syrup. If it doesn't respond after the second treatment, or if the symptoms become worse, then you need to seek the assistance of your veterinarian.